Chronic obstructive pulmonary disease (COPD) is a slow-progressing destruction of airways caused by gradual loss of lung function. It's a combination of various lung diseases. In COPD, two lung diseases, namely chronic bronchitis and emphysema, are the main diseases. Other diseases like asthmatic bronchitis and bullous disease are also present. This disease is common among the older women in America. On a whole, about 11% of the American population suffers from COPD. According to researchers, it kills 85,000 people in the U.S. every year, and it is the fourth leading cause of death. Smoking is the primary cause of COPD. Passive smoking can also lead to COPD. The effects of smoking on the lungs can be severe and permanent. Smoking causes irreversible damage to the lung tissues and causes inflammation of the lungs. This inflammation stops only when the smoking is stopped. The cigarette manufacturing companies add some chemicals to cigarettes for various reasons that block the production of alpha-1 antitrypsin (AAT), which maintain the elastic fibers of the alveoli. This in turn destroys the walls of the lungs, which makes the process of breathing very difficult. Other causes that lead to COPD are industrial pollution, occupational dusts, continuous contact with hazardous chemicals, outdoors air pollution, etc. In some cases, parents pass on the genes to their children. In some rare cases, COPD is found in people suffering from a gene-related disorder called alpha-1 antitrypsin deficiency. Alpha-1 antitrypsin is a protein that inactivates the destructive proteins in the blood. The absence or the low level of alpha-1 antitrypsin in these people leads to the destruction of lungs and ultimately to COPD. As the disease intensifies, the patients suffering from COPD will find it difficult to breathe. Their difficulty may vary according to the changing weather. They sometimes require hospitalization. Prevention is the best medicine for COPD. There is no cure. All the medications for COPD are directed towards reducing the intensity of the disease. So, it is wiser for all of us to take steps to prevent this disease. Chronic obstructive pulmonary disease or COPD does not have any cure. But with the help of medicines and cessation of smoking, it can be kept under control. Different types of medicines cure different types of symptoms. Mucus, breathlessness, cough and fatigue are all the symptoms of COPD. Based on the intensity of the particular symptom and the prescription given by your doctor, you can use one or more than 5 types of medicines available to keep COPD under control. Bronchodilators help ease breathing. The medicine in a bronchodilator opens up the airways of your lungs and eases breathing. Oxygen therapy is suggested if it is becoming difficult for your body to get enough oxygen into your bloodstream. Oxygen therapy lessens breathlessness and improves physical stamina in patients suffering from COPD. COPD patients often suffer bacterial infections that can cause severe flare-ups in the lungs. In such cases, antibiotics are used to kill the bacteria. Different antibiotics such as Cipro, Amoxil, Septra, etc., kill different bacteria. Sometimes, because of extreme flare-ups in the lungs, a COPD patient may experience flu and pneumonia. Here, vaccines are given to decrease the intensity of the symptom. Some COPD patients experience severe cough and inflammation in the lungs. These patients are prescribed anti-inflammatory drugs. These medicines are usually in the form of corticosteroids. Anti-inflammatory medicines reduce cough and inflammation in the airways of the lungs. Usually, the patient inhales them. Although corticosteroids are primarily given to asthma patients, they can also help those COPD patients suffering from severe cough and inflammation in the lungs. Based on the symptoms and the individual reactions to the medicines, doctors prescribe various medicines. But all COPD patients should take some precautions while they use these medicines. Taking the medicines as directed, not stopping them without consulting the doctor, not sharing the medicines with other patients, planning for the refills well ahead of time and being well aware of the effects and side effects of a medicine before you start taking them, etc., can be extremely beneficial in containing the symptoms of COPD. Contact your physician if you experience any side effects from these medicines. They can be increased shortness of breath, allergic reactions, prolonged nausea, vomiting, prolonged muscle cramps, or heart palpitations, white spots in the mouth and vaginal itching. Thank you for watching. Please don't forget to like and subscribe to my channel, and please click on the bell so you'll be updated on my next video. Thank you. WeCare for UPH. Your health comes first.